So dangerous to use multiple pharmacies, and here's why. Hi, I'm Chelsea, a retail pharmacist, giving you a look at life behind the pharmacy counter. And I understand times are difficult, medication is expensive, and sometimes there are circumstances where you're going to use multiple pharmacies. When that happens, make sure that you always have an updated medication list with all of your pharmacy's contact information on it. Had a patient come to my pharmacy, we'll call my pharmacy ABC Pharmacy. Patient has been filling at XYZ Pharmacy. XYZ Pharmacy will not fill their GLP-1 because they're losing money on the GLP-1. Patient wants to get GLP-1 from me at ABC Pharmacy. I tell patient, yes, but just keep in mind, like, I'm not gonna be able to check for drug interactions because I'm not gonna have any idea what you're on, and for your safety, I wish that you would fill everything here. Patient says no, they don't want to do that. Okay, that's fine. Patients can decide that. Okay, patient gets admitted to the hospital months later. Patient, when it is admitted to the hospital, tells hospital that they use XYZ Pharmacy. Hospital calls XYZ Pharmacy for med list. GLP-1 is not on the med list because they don't fill it there. Patient has to have surgery. Patient has some problems with the anesthesia because they're on the GLP-1, and according to the patient, the anesthesiologist let them have it because those problems could have been avoided if the hospital had known that he'd been on the GLP-1. Patient comes back to me and they're like, okay, I was kind of grumpy with you. You were absolutely right. I should be filling all my prescriptions at one pharmacy. I see that now. Anyway, if you're having to use multiple pharmacies, make sure that you have that medication list, because we're not asking you to use only one pharmacy for us. We're doing it for you because your safety can be impacted when the pharmacy does not have the full story.